Hello students, welcome back to Easy Nurse, where nursing education made easy. So here we are Easy Nurse, we are going to take live about the maternal nursing. So in this live session, mainly we are going to discuss regarding the pregnancy. So what the physiological changes are happening during the pregnancy journey. Okay, so let's start about today's live session. First, we have to know about the meaning or the definition of the pregnancy. So, pregnancy is nothing but after conception or after the fertilization. So, when does the fertilized zygote is going to implant in the uterine wall, so after that it's going to begin as a continuous journey for the carrying fetus or the embryo in the womb of the maternal of the mother, which begins at the fertilization, and this continuous process is going to be end after the delivery of a healthy baby from the inner side of the womb to the outer side of the world. Okay, so that is called the pregnancy. So although this pregnancy is involves into the three trimester. Okay, so each and every trimester is considered as a 3 months of the beyond time period. So let's see, first trimester is first 3 months, means 0 to 12 weeks. Next one is the second trimester. So from the 12 weeks it begins and it's going to be ends from the 24 weeks. And last is the third trimester, which is starts at the 25th week and it's going to be end around 37 or the 42 weeks. So next come to the physiological changes during the pregnancy. So during this pregnancy time, overall the system of our body or the maternal body is going to be changes. So based on the system wise, the physiological changes are happening due to this hormonal balance as well as the like organs displacement. Okay, so let's see, first is gastrointestinal system, next one is the reproductive system, you can see the changes. Next one is the integumentary system. So integumentary system is nothing but like regarding the skin. Okay, so next one is the circulatory system, then respiratory system, next one is the body weight and urinary system, skeletal system and endocrine system. So can you please tell me body weight, what are the changes you can see in the body weight? Suppose before conception of the pregnancy, one mother was having 55 kg. So after this conceiving of the pregnancy, like around when she will touch around the 9 weeks or 9 months of the pregnancy, so that time the weight of the mother should be 55 plus 12, means minimum 12 kg they have to gain it. Okay, so it's come to the 67 kg. So if the mother will gain above to 12 kg during this pregnancy journey, so means the fetus is also growing very healthy and mother's body is also ready for the delivery. Okay, so these all are the changes you can see during the body weight during this pregnancy journey. So now come to the first reproductive system changes. So what are the changes you can see? First we have to discuss regarding external reproductive organ. So first we have to know what are the organs are present in the external reproductive organs. So external reproductive organs combined, it's also known as a vulva, right? So in this vulva there are so many parts are there, like labia majora, labia minora, clitoris, vulva, as well as vagina, urethra, Bartholin ducts and then perineum. So total 9 organs are including in this external reproductive organs. So vulva, it becomes the odematous. Odematous is nothing but like swelling. Next one is the hyperemic. So excessive circulation you can see in those area. Superficial, it's becoming very thin. Next one is the varicositis, especially you can see for the multipara. Multipara is nothing but those mother who already delivered 1 or 2 baby before delivery of that particular baby. So those mother is known as a multipara. Okay, next one is the labia majora. So for the labia majora, it's become very pigmented. So those area is becoming so much dark due to this pigmentation, hormonal pigmentation, as well as the hypertrophied. Hypertrophied is nothing but excessive cell accumulation you can see in this particular area, as well as the subcutaneous fat accumulation also you can see. Next one is the perineum. So for the perineum, it's become very enlarged, increase the vasculature, means circulation, you can see excessive circulation as well as the hypertrophy of this perineal body and disposition of the fat. Next one is the vagina. So vaginal wall is becomes the hypertrophied, hyperplasia, edematous and then vascular, which is increase the blood supply surrounding the vaginal walls, which gives the bluish discolorations, which is also known as a Jacquemus sign. This is also one of the most important viva questions. What is the Jacquemus sign? So Jacquemus sign is nothing but it's a bluish discolorations of the vaginal wall. So that is called Jacquemus sign. Next is come to the breast. So accessory reproductive organs. So for the breast in the early pregnancy, what is happened? This breast is becoming as a tingle and increase is also size when this pregnancy is going to be progressed. And then areola of the nipples is become very dark and then diameter of the areola is also becoming so increased. Next is the Montgomery's glands is going to be enlarged and tend to produce the milk. Next one is the surface vessels of the breast. It might be visible due to increase the circulation over there, and it also turns to the bluish tints of the breast. So that's why you can see the greenish veins when this during this pregnancy journey due to this enlargement of the breast sizes. So what is happening? The outermost layer of the breast is becoming very thin. So what is happened? The vein you can it will be visible especially like last trimester of the pregnancy period. By the 16th week, what is changes are happening? The breast is begin to produce the colostrum. Colostrum is nothing but fast milk production. Next one is this is becoming very precocious for the milk and is very becoming thin, watery as well as the yolk secretions that the thickens during the pregnancy progress and is extremely high in protein. So colostrum is nothing but it's a protein rich diet for the newborn baby, as well as it also helpful for to increase the immunity for the baby, because in this the colostrum mainly which immunoglobulin should be present, that is immunoglobulin A, rich in immunoglobulin A as well as the calcium. Next come to the changes in internal reproductive system. So internal reproductive system is nothing but like uterus, vagina, cervix, fallopian tube, ovaries, etc. So for the uterus, what are the changes are happening? Uterus become phenomoid shape and this uterus will also have the increase 5 times in the normal size. So length its changes, see 6.5 centimeter to 32 centimeter is going to be changed. Next is the depth. From the 2.5 centimeter is becoming as a 22 centimeter. Weight of weight from 4 to the 24 centimeter is becoming changes, and the weight from the 50 gram is going to as a 1000 gram. So next is thickness of the wall is becoming very less, right? So from 1.1 centimeter to 0.5 centimeter. So see, this is the image, and this is the structure of this fundal height of the uterus. It depends on the pregnancy progress. Okay, so mainly when the pregnancy is going to be as a third trimester, so we have to remind the fundal height should be beyond of the navel size. Okay, so that like this way we have to measuring the fundal height. Next is the capacity of the uterus. This must be expand normally, like accommodate a 7 pound of the fetus, including with the placenta, umbilical cord, 500 ml to 1000 ml of the amniotic fluid as well as the fetal membrane. So these all are the viable products of the conception should be present inside of the uterus. So that's why the capacity of the uterus is also increasing while the pregnancy is going to be progressed. Next come to the changes in uterine layers. So what are the changes? So first we have to know what are the layers are there. First is the myometrium, next is the endometrium, and last one is the perimetrium. So see, first myometrium, what are the changes? The mechanism, due to this mechanism of the uterine enlargement, its myometrium is going to be very stretchful and then hypertrophy of the muscle fibers. So what is happened? The increase in the elastic tissue as well as accumulation of the fibrous tissue in the external muscle fibers. So now we have to see the arrangement of the membranes. This is the most important arrangement of the myometrial membranes. First, outer longitudinal membrane. So outer longitudinal membrane is arranged over the fundus. Next is the inner circular. It's becoming very scanty and sphincter-like arrangement. Next one is the intermediate. It's becoming very thick, and the strongest layer is going to be fashionable as a crisscross section. Okay, so this is the image. First is the outer layer or the longitudinal, so it's obviously should be present over the fundal height. Next one is the middle layer or the inner circular layer, so it should be very scanty and the sphincter-like arrangement. And last is the intermediate or innermost layer, so it should be very crisscross in fashion. Okay, next come to the transformation of the shape. So early months means early months of the pregnancy, the shape of the uterus should be pyriform or the pear shape, means small bean strap structure. At the 12 weeks is becoming as a globular shape, and at the 28th week is come to the dome shape, and last 36 weeks is come as a ovoid in manner. So this is the changes, shape changes of the uterus based on the week. Okay, next come to the changes of the position. So what are the position? First, uterus grows elevated out of the 12 to 16 weeks, can palpate at the symphysis pubis. Okay, so means early pregnancy you can palpate the fundal height near to the symphysis pubis. At the 20 to 24 weeks means near to the third trimester period, you can assess the fundal height at the level of the umbilicus or the navel system and near to the xiphoid process. Okay, at the end of the pregnancy means till the last means near to the third trimester, so that time you can feel the fundal height near to the xiphoid process or the xiphoid sternum process. So do you know what do you mean by the xiphoid sternum? That is the breastbone, right? Next, the size of the uterus usually reaches its peak at the 38th week of the gestation period, and this uterus may drop slightly at the fetal height, which settles into the pelvis and which is preparing for the delivery. So this dropping section is known as a lightening. So beyond of the third trimester or near to the third trimester or the mid time of the third trimester, what is happened? If everything is okay, means there should not be any complications, so that time the fetus head or the presenting part is going to be stuck over the outermost layer or the brim cavity of the female pelvis, and the mother, they can feel the something is stuck inside of the pelvis. So that feelings is known as a lightening. So when this head is going to be engaged inside of the outermost cavity of the female pelvis, so that process is known as a lightening. Next, the Braxton Hicks construction. So what you means by the Braxton Hicks construction? It's nothing but it's a false labor pain. It's also known as a false labor pain. So you can see this in the early pregnancy time. So normally for the true labor pain, what is happening? This labor pain is going to be started from the lower part of the part of the abdomen. Okay, so from this side means from the uterus ostia part is going to be started. After that it will come to the fundal height, then it will come to the midsection, then it will come surrounding all over the uterus, right? And the pain you can feel from the front side to the back side. But for this the Braxton Hicks construction or the false labor pain, you can't feel any pain during the lower abdominal side or upper abdominal side. The pain will start from the back side. In the spinal cord you can feel the pain, and this pain should be very irregular, it's very infrequent, and it is a ineffectiveness for the cervical assessment as well as the cervical dilatation. Okay, so as we know, like true labor pain is very helpful or effectiveness for the cervical dilatation, right, for the preparation for the delivery. But the false labor pain, it not be effectiveness for the preparation for delivery or the cervical dilatation. So that is the difference between true labor pain and false labor pain. So true labor pain, from front side to back side you can feel the pain, but for the Braxton Hicks construction or the false labor pain, it will come from the back side to the front side. Next come to the endometrium. So endometrium during this pregnancy is also known as a decidua. So for the 2 marks questions or 1 marks question, they ask you what is the meaning of decidua. So that time you have to know, you have to tell like endometrium layer of the uterus or the middle layer of the uterus during the pregnancy or after implantation of the fertilized ovum is known as a decidua. So this decidua is formed by the 3 layers. First is the superficial compact layer, It's compact of the decidual cells, gland ducts as well as the dilated capillaries. You have to know the components, okay? So for the superficial compact layer or the outermost layer, what are the components? Decidual cells, gland ducts and then dilated capillaries. Next is the intermediate spongy layer or the middle layer. So for the middle layer, the component is nothing but dilated uterine glands, decidual cells and then blood vessels. Next one is a thin basal layer or the most innermost layer. It's a basal portion of the glands and it's very opposed to the uterine muscle. Okay, so this is the image of the endometrium. Now come to the perimetrium. So for the perimetrium, this is a thin layer of the peritoneum cavity which mainly protect the uterus, interelastic base which doesn't cover the uterus bladder part as a uterovesical pouch. So during this pregnancy journey, this part you can feel as a pouch. So that pouch is known as a uterovesical pouch and this rectum part as pouch of a Douglas. Okay, so this uterine blood flow is going to be increased progressively and it's going to reach about 500 milliliter per minute. So this formations of the lower uterine segment you can see after the 12 weeks of the pregnancy. So the isthmus, which is 0.5 centimeter, is going to be start and expanding gradually to from the lower uterine segment, which measures as a 10 centimeter in length at a term. So see the image. There should be any before conceiving the pregnancy, there is no kind of any deviation, right? So after conceiving the pregnancy, the lower segment of the uterus you can see is going to be started to process. After the 12 weeks only you can see this differentiation. So what is happened, that isthmus part of the uterus means where the ampulla is going to be attached with the uterus, right? Ampulla in the sense like a fallopian tube. So this part is going to be very much expand and this started to expand gradually and that part only is going to be forming as a lower uterine segment. Then so that time only this like two part deviation you can see at the end of the pregnancy journey. So that this part is known as a lower uterine segment and upper part is known as a upper uterine segment. So in this upper and lower uterine segment junction you can feel one line. So that is called as a lower uterine segment. So now come to the cervix. So for the cervix, what are the changes? The cervix there undergoes marked softening which is referred as a Goodell sign. So these signs are also one of the most important questions. Goodell sign is nothing but when cervix is going to be very softening during pregnancy. So that time is known as a Goodell sign. When cervix is coming as a bluish discoloration, so that time is known as a Jacquemus sign. And this additional changes or softening of the tissues which is occur at the beginning of the labor or at the onset of the labor, means during the second stage of the labor period. Next come to the mucus plug, which you can see that is also known as a operculum or also known as a blood plug. Okay, this also known as a blood plug. So this mucus plug which is known as a operculum is formed as a cervical canal and this is the result of an enlarged and then active mucus gland of the cervix. So what is happened, it serves to seal the uterus and to protect the fetus as well as the fetal membranes from the infection. So for the multipara omen, you just remind multipara omen, this mucus plug or this the blood plug is going to be sealed out from the uterus during the labor or the onset of labor. But for the primigravida mother, it's going to be unsealed before 24 hours of the labor as well as during the labor. Okay, so this is the difference for the multigravida as well as the primigravida mother. So this mucus plug is expelled at the end of the pregnancy. This is occur at the onset of labor or processed the labor by a few days. So when this mucus plug is going to be stinged with a blood, so that time is known as a bloody show. So sometimes they ask you what is the show presentation. Same, that is only bloody show, mucus plug, blood plug, everything as a like a this is operculum. Okay, so there are so many synonyms for this bloody show or the show presentation. So now come to the ovaries. For the ovaries, what are the changes? The FSH or the follicle stimulating hormone, this sees their activity. Why? Because placenta is going to be progressed during this time. So mainly this what is happened at that time, estrogen and progesterone level is going to be increased in the circulatory system of the mother, so which is secreted by the ovaries and then corpus luteum. So at the end, during this pregnancy, corpus luteum is also going to vary and lose during early pregnancy and may often form a cyst on the ovaries. So this is the reason the mother who doesn't have the PCOD syndromes or anything, but during the pregnancy they can get the PCOD syndrome due to the corpus luteum engorgement on the ovaries. Okay, so this corpus luteum there produces the progesterone to help maintain the lining of the pregnancy. So what do you mean by the lining? Means endometrium layer of the early pregnancy, means decidual lining. Okay, so the function is going to be like around 10 to 12 weeks of the pregnancy, when the placenta should be capable of producing estrogen and progesterone. So until the production or proper production of the placenta, the ovaries, especially the follicle stimulating hormone, they are only going this activity. But after complete production of the placenta, when this placenta is capable to produce the estrogen and progesterone or the necessary hormones which all are needed to maintain the lining of the pregnancy, so that time the ovaries ceases their activity. At the time of the interval, it start to decrease in size and function the slowly. Okay, so that these are a lot the changes is happening in the ovaries. Now come to the fallopian tube. So for the fallopian tube, what is happened? Uterus, their end rises up and then the femoral end, which is held by the infundibulopelvic ligament. So it is placed almost vertical by the side of the uterus. So this vascularity is going to be increased at the term. So attachment is also lower end of the upper 1/3 of the uterus. So now come to the changes in integumentary system. So sometimes they ask you like what are the physiological changes is happening during pregnancy. So that time you have to mention all the system, but particularly they will ask you either integumentary system or reproductive system or gastrointestinal system or cardiovascular system. So then at that time you have to write the like questions and answer as a briefly particularly of that particular system. Okay, so now come to the integumentary system or the skin changes. So due to this, the alteration of hormonal imbalance and then mechanical stretching, so several changes you can see during the skin. Okay, so first is the linea nigra. Linea nigra is nothing but it's a very dark line which you can see from the xiphoid sternum to the symphysis pubis. Okay, at the end of the symphysis pubis. So that lining is known as a linea nigra. It's nothing but it's a hormone induced pigmentation, and after the delivery it might be fade, but for the some mothers it should not be complete disappeared. This line is known as a linea nigra. You can see from the end of the part of symphysis pubis till the part of the xiphoid sternum or the xiphoid sternum process. So that line is known as a linea nigra, and it should be present over of the nervous system. So that is called linea nigra, and it's nothing but it's a hormone induced pigmentation. Now come to the mask of the pregnancy or the chloasma. So you can see on the face. So this is a brownish hyperpigmentation of the skin over the face and forehead. So it gives you like a bronze look, especially in the dark complexion women. It begins around the 16th week of the pregnancy and regularly increases. But after the delivery, it's going to be fade. But for some women, it should not be fade. Okay. So now come to the stria gravidarum or the stretch mark. So stria gravidarum is nothing but it's maybe due to the action of the adrenocorticosteroid hormone. So due to this, the excessive level of the adrenocorticosteroid hormone or excessive accumulations of the fat over the lower abdominal region as well as the waist region, you can see this kind of the stretch mark. So this reflects the separation with the underlying connective tissue of the skin. So especially the like when subcutaneous fat will be engaged in a one particular part over the under the skin is very much or excessively, so that time you can see the separation or the stretch mark. So what is happened, this occurs over areas of maximum stretch of the abdomen, thighs and the breast. Okay, it usually disappear after the delivery, but although sometimes they will not be completely disappeared. Now come to the sweat gland changes. So activity of the sweat gland throughout the body is going to be increased, which is for that what is happened, the women they are perspiring more profusely during this pregnancy period. So now come to the wrist region or the fine hair growth. So fine hair growth over the face, which you can see due to this excessive hormonal like imbalancing as well as replacement. So what is happened, this going to be disappeared after the delivery. So now come to the palmar erythema, that is nothing but like pinkish red diffuse mottling type of the rashes you can see on the palm, especially on the hand palm. 60% omen. For the white omen you can see. Now come to the changes in circulatory system. So for the circulatory system, first is the blood volume level. Blood volume level is going to be increased gradually. 30 to 50% cases means around 1500 ml to 3 units. So this result decrease the concentrations of the blood cells as well as the hemoglobin level. So that's why during this pregnancy, maximum women they are going to be diagnosed with a anemia. Okay, due to this the level of the hemoglobin, due to this increase of the blood volume. So if the blood volume level is increasing but the blood concentration is going to be decreased, so what is happening? Hemoglobin level automatically it will be decreased. So if the hemoglobin level will be decreased, so obviously the mother will go for the anemia. So that time the blood replacement therapy we have to go, or the blood transfusion. Next, by the time of the pregnancy reaches term, the body has usually compensated for the decrease, resulting in an essentially normal blood count. So the blood count is going to be interrupted as anemia by the physician if the hemoglobin level below 10.5 gram per 100 ml and hematocrit drops below the 30% cases. So if the hemoglobin level should be if the hemoglobin level is going to be below the 10.5 gram per unit, so what will happen? The child also is going to be affected by the anemia. Okay, because the placenta barrier they are not going to be protect the hemoglobin. Okay, so that's why due to this low hemoglobin concentrations of the mother's body, fetus is also going to be affected by the anemia. Now come to the cardiac output. So cardiac output is going to be increased about the 30% during the first and second trimester of the pregnancy, and it's also is going to accommodate for the hypervolemia. So the patient with a heart disease, they are especially at a high risk for the cardiac decompensation 28 to 35 weeks of the pregnancy, when the blood volume and cardiac load should be in a peak time, and it's also during delivery as well as immediately after delivery. Next is the changes in the output for reflection in the heart rate, which is increasing by the 10 beats per minute. So now come to the blood pressure. Normally the patient blood pressure will not rise, but in spite of the large increase of the cardiac output as well as the blood volume, the maternal BP like cardiac output into the SVR. SVR is nothing but systemic vascular resistance. So this combined factor is going to be increased. So obviously blood pressure is also going to be increased during the pregnancy journey. Now come to the venous return. So the lower extremities is becoming swelling, so is going to be hampered, especially the last month of the pregnancy due to this expanding of the uterus. Okay, so what is happened? Physical movement is going to be restricted by the doctors, as well as it's also interfering with the blood flow, returning blood flow. So what is happened? Blood flow normally will come from upper part to lower part, right? But what is happening from the upper part? It's going